Welcome back to Cancer Buzz TV, the show for the oncology care professional. I'm your host, Summer Johnson. Today we're sharing tips for care coordination for patients with acute myeloid leukemia, or AML. Care coordination plays a major role in accessibility to treatment options, especially within community care settings. We'll discuss strategies for overcoming some of the common challenges facing this patient population and best practices for optimized care coordination. Joining us today are Dr. Geoffrey Uy, a professor of medicine in the Division of Oncology at Washington University School of Medicine in St. Louis. Dr. Khoan Vu is a hematologist oncologist at Texas Oncology in Dallas. Thank you both for joining me today. Dr. Vu, what does successful care coordination look like?
Yes, that's a really great question. And for me, what successful care coordination looks like is a seamless transitions of care where we work together as a cohesive team, even if it's different cancer centers who are taking care of one patient. It should be a seamless approach with a consistent message and a consistent treatment plan that we communicate to the patient. I remember when I was an oncologist at Kaiser in Northern California, I was taking care of a lot of patients in malignant hematology. So, treated a lot of leukemia, lymphoma, and myeloma patients who eventually need bone marrow transplant, CAR T cell therapy. So, at my center, we would do the initial induction treatments or their salvage therapies. But when it comes to bone marrow transplant and CAR T cell therapy, we would then refer those patients to a more specialized large academic center. In this case, it was Stanford that we refer patients to. I think that's what I would consider a successful care coordination is having, again, that consistent messaging, um, cohesive team approach in taking care of the patients.
Dr. Uy, what advantages can care coordination have for patients?
Well, I think it can be tremendous. We are in St. Louis, a large academic medical center, but we're the only real major transplant center within a 4-hour radius. So, patients, a large proportion of our patients come from several hours away. For treatments that require daily infusions, frequent frequent monitoring, uh, it's not possible for those patients to remain as an outpatient and travel back and forth to our center. So through care coordination, through things like telehealth, we can deliver high quality care to patients in their community. And that's really the goal for a lot of patients. And it's tremendous both for the patients and their caregivers, not spending, 3 to 4 hours a day in a car going back and forth seeing their provider.
What are some of the treatment challenges these patients face?
I think fundamentally it's important to remember that AML is a uncommon disease. So even though community physicians kind of do an outstanding job taking care of these patients, it's not something that they necessarily see every day. And with the emerging treatments, the new diagnostics, we have it's created a lot of complexity in the management of these patients, and it's really important for community physicians like Dr. Vu to have individuals who have specialized expertise with this disease that they can contact and rely on to communicate or bounce questions off of, or to refer these patients when needed. And so, this gets into the whole idea that, it really needs to be a team approach, especially for patients who live several hours away from the academic medical center. And that through this coordination of care, through the use of technology, hopefully we can deliver the best care possible for our patients.
I agree with everything that Dr. V said. when it comes to the challenges that come with transitions of care, I think the constant communication back and forth between the primary oncologist, hematologist, and the transplant team, for example. And a lot of times patients can get very sick or their clinical situation changes very rapidly. So the treatment plan can change very fast. And so there needs to be that constant communication. So those can be some challenges. And uh, sometimes there are situations where the doctors might have conflicting messages for the patient or different treatment plans. So it just comes to show that it's very important to have consistent, open communication between the different teams.
What are the barriers that come with the transition toward hospice care?
Yeah, so when it comes to hospice and comfort care, specifically for heme malignancies like leukemia or lymphoma, I would say one of the challenging things is that I would say the majority of hospice groups, they don't allow transfusions for these patients. And sometimes these patients need transfusions for quality of life, like if they become really anemic and become really short of breath or tired because they lack blood. They need these blood transfusions, but a lot of times that's not allowed in hospice. So it can be very challenging to easily transition patients with leukemia where they're still needing frequent transfusions to go on to hospice because of that lack of support. I think historically, patients with heme malignancies, they tend to go onto hospice at the very near end of life, in contrast to a lot of the solid tumor patients that I've taken care of.
Right, I agree with that statement. Heme malignancies are inherently different in that there are patients who we do not have any sort of therapeutic options available except for supportive care, transfusion support. But at the same time, many patients can maintain a reasonable quality of life just receiving transfusions without active therapy. And because of the sort of current regulatory environment and reimbursement environment, these patients, can't receive hospice benefits while they're being actively transfused, and really this can be a disservice to our patients, and like Dr. Vu mentioned, it often results in late referrals to hospice or palliative care, which in patients who may otherwise benefit from their services.
Thank you, Doctors Uy and Vu. For additional links and resources on care coordination for the treatment of patients with AML, you can check out the show notes. Today's episode was made possible by funding through Bristol Myers Squibb. On behalf of all of us here at Cancer Buzz TV, thank you for watching. This is Summer Johnson.